that the case? Now, and that is the conversation you're having today with Ignatius Kibe, a gynecologist. But as always, be reminded that our phone line is open. We'll be very happy to hear from you. And the number will be on your screen, of course, as we continue this conversation. But on Facebook and YouTube, also interact with us at TV47 Kenya, even on X, at TV47 News KE. Don't shy away. Daktari is here to answer all the questions that you have. Good morning.
Good morning. Good morning.
Now, you have very many years of experience in this particular topic. And you know, when we're talking on the side, you told me that, and you also joked that you're a boomer. But you see, with...
Whatever boomer is, yeah. What do we boom? Children?
You boom life. So,
because in our time, unless you have 7 children, then you are not a man. So boomers are people who brought population to this world.
Okay, we digress. But right about now, you see, I started with saying when you talk about UTI is often associated with women. Is this the case? Do men also get UTI?
Takes 2 to a tango. So indeed, I would like my viewers and listeners to look at UTI differently, because it's a new language that ladies have brought up. Urinary tract infection.
Yeah.
But what they call urinary tract infection is a misnomer, and it is too shallow, because urinary tract is only one system. When we were in primary school, we were taught several systems: digestive system, central nervous system, excretion, and blood, cardiovascular system. So urinary tract infection is only the urinary urethritis, that is the pipe that brings urine, and the bladder. And probably you can include the kidneys at the top, because they are the ones that filter blood to convert it into. But then there is a neighbor immediately below that, the V, where the baby comes from, where your periods come from. So what people are calling urinary tract infection are not urinary tract infections. Actually, urinary tract infections graduate to pelvic inflammatory diseases. This is the pelvis, below the umbilicus, the pelvic inflammatory diseases, and sexually transmitted infections. We call it UTI, and it is not UTI. Somebody has a 30-year-old syphilis, and she still says a UTI. Somebody is discharging chafu, a lot of dirt, from the V, from the genitals, from the area where the baby comes out of, the area where the man enjoys himself. That is not urinary tract. Urinary tract is only a small portion of the whole structure. And I'm surprised in my practice that even women do not know their own anatomy. Namuuliza hii iko wapi, hajui. Namuuliza what is the difference between urinary tract and reproductive tract, hajui. Na niye anabeba hizi vitu. So that's what I want to correct you and tell you, that we are discussing the genital urinary tract. And ladies should stop using the word UTI. Say, I don't know what I'm carrying. It could be in the urinary tract, it could be in the urinary, it could be in the genitals, could be in the reproductive system. So the body is divided into systems. So what are we talking about? Urinary tract is only, like I said, the external parts of the urine system, the urethra, and the urinary bladder, and the kidneys, period. But when somebody goes and does her thing, call it urinates, and a few drops are left there, and they trickle down to where the baby comes out of, where the man goes into, then it is no longer urinary tract. It is now a pelvic inflammatory disease. I will define inflammation if you want.
Yes, please.
That is a situation where bacteria like gonococci, gonorrhea, spirochetes like syphilis, chlamydia, Escherichia coli, they inflame, they go and colonize, they go and infect the sexual organs. You can't keep on saying, I have a urinary tract chlamydia, I have a urinary tract syphilis, I have a urinary tract gonorrhea, I have a urinary tract, and some of them smell. The urinary tract one does not smell. Here we are talking about the protozoans. We are talking about something we call Trichomonas vaginalis. It's called the TV, kawaida. We are talking about Gardnerella. So there is a misnomer. Let the lady go and explain to her doctor, and you doctors, nyinyi madaktari, everything is not urinary tract. There are the genitals, they are the reproductive system. And when a lady tells you I have a UTI, you must broaden her and tell her, na iko na chafu, na inanuka, is it thick and yellowish or creamish, or is it thin and, we must get to know where is the infection. And stop also giving tablets of clotrimazole. Tablets ati weka hizi uko ndani. No. What are you treating, bwana? In fact, that tablet cannot go to, that pessary they call it, is a tablet, cannot go to the urinary tract. It doesn't go to the urinary tract. It goes to the reproductive system. So when you are sick, when a lady notices she's discharging yellowish or creamish or whitish stuff, and the lady notices she's scratching herself, and the itch, pruritus, we call it in our language, pruritus, itch of the genitals. Let us go broader. Let us not, it's like mentioning niko na tabu ya uso. Uso has eyes, uso has nose, uso has mouth, uso has the forehead. So what is, when you say I have an infection or I have a skin disease on the uso, where? So that word is being misused by both the doctors and patients.
Now, you've told us what a urinary tract is, but what does UTI feel like now that it's misused? Somebody maybe just has a yeast infection and they're talking about having a UTI. What does it feel like? What does it look like?
An ordinary urinary tract infection will come with probably UTI now. Will come with an itch, small pruritus itch, and a scratch. It may come with a small inflammation. Inflammation, I said, I promised that I would tell you what an inflammation is. It's like a flame has gone past it, amechomeka. It's like there are small skin rash around the urinary system. Urinary is not genital, is not kule chini, ni hapa juu. And the lady frequents the ladies. She has what we call dysuria. Every 10-20 minutes, she excuses herself, goes to the ladies. Every 30 minutes, she goes to the ladies.
A serious urge to urinate.
A serious, we call it in our language, frequency.
Okay.
Frequency of mixturation is frequency of urination. And she'll also have what we call urgency. When it comes, it has come. If you don't go quickly, utajikonjolea. That is now UTI. Because there is inflammation, ni mahali kumechomeka. We said from the word flame, inflammation. If the bladder is the bladder wall, kule ndani ya bladder, the lining of the bladder has inflammation, iko na rash. Then every small amount of urine, unakimbia ladies. Every small amount of urine unakimbia ladies. You can go in one morning, you will not even finish this show before you go 3 times. Then I will know this girl has a UTI, which contrasts with PID, pelvic inflammatory disease. PID, pelvic. And I said pelvic is below the navel and above the pubis, around there. Pelvic, there is inflammation, ni kama imechomeka. That is the V and the inside, the introitus. And it can continue to the uterus, past the cervix. So there are 2 different systems, but because they are neighbors, it's just like here you are right now you are my neighbor.
Yeah.
So whatever I would do here, it will affect you. Some people used to smoke, and the smoke used to affect secondary smoke. Somebody who is in the neighborhood. It's like you have a farm, and I have a farm, and you are there next to me. And there is what? Couch grass. It grows past. So the UTI can grow past, and it goes to the reproductive system, where watoto wanazaliwa, or where the man does his thing.
Yeah.
So there is a big difference between UTI and PID. And PID, because these are, I said, they could be bacteria, they could be inflammation of viruses like HPV, human papilloma virus, which causes cervical cancer. It could be hyperinoidal herpes, Verrutia vulgaris. It could be those other things that go to the mahali ya kuzalia, the direction of the baby and the man.
Yeah.
That is pelvic inflammatory disease. And because it is shared by 2 people, I said it takes 2 to a tango. If a man goes there, he comes out with it. So it becomes a sexually transmitted disease, STD. So a UTI can trickle down, graduate to become a PID, and then graduate to become sexually transmitted. Sababu mwanamume akiingia huko atoke, anabeba. So it becomes an STD. So don't mix these 3 things.
Yeah.
And you doctors, gynecologists, my colleagues, be very careful. And at this juncture, let me also warn these girls who go over the counter and say,
Yeah.
niuzie zile tembe za kusafisha huko. Hapana. Kusafisha wapi? You are dealing with ati niko na UTI. Kumbe you have a severe acute hiding or obvious gonorrhea or syphilis, like I said, or chlamydia, which can even make you infertile. And you are still calling it UTI. So be very careful and don't treat yourselves. Girls, please. It's like you are taking a small toy and you want to kill a buffalo. And what it treats UTI does not necessarily treat STD, does not necessarily treat a PID. So they are all different, and they should be differentiated.
And you know, there are over-the-counter UTI test strips. Now that you're talking about over-the-counter medicine, are these over-the-counter test strips reliable?
No. We have a big problem. I still feel that you need to do what we call culture and sensitivity. I still feel that we should do a high vaginal swab, a HVS, to identify, because there is a big problem. There is a big problem, especially in Africa, mixed infections. Kuna mtu ako na virus, the same person ako na bacteria, the same person has a fungus, ako na candida, for example. That's a fungus. At the same time, ako na chlamydia, that is a bacteria. At the same time, ako na herpes, a virus, a bacteria, and a fungus. So that is a test strip which is intended to show whether you have chlamydia, cannot detect candida. The drug for candida cannot treat gonorrhea. The drug for virus, a viruside, which can treat herpes or can even improve the situation down there for viruses, cannot deal with viruses. An antiviral drug cannot deal with a bacteria. No, it will never. So this is the problem of over-the-counter tests. How, unless you get one that differentiates all the 5 or 6 different classes or groups of diseases. I'm giving another example. Cancer of the cervix is viral, is human papilloma virus, is a virus. It has the same signs and symptoms as chlamydia. So how do you differentiate, and why are you giving a tablet that will not do any good to this person? That is why I'm insisting that don't treat yourself. Na nyinyi madaktari wenzangu, please do culture and sensitivity. And if she has had it for 3-4 weeks, she has had it for a month. Some have had the problem for years. Ati hii chafu nimeiona karibu miaka 5. What about 72 hours for you to do a high vaginal swab and know what you are dealing with?
Having it for 5 years, Dr. Isn't it painful?
No, it is uncomfortable. But many people, get used to it. Anajikuna kiasi. And that is why we have so many and very many problems of infertility. Even if it's pain, anaenda anajitibu, ananunua, ati naenda kununua sijui brufen, naenda kununua paracetamol, naenda kununua, there is one notorious one called aceclofenac, diclofenac. No, they go and buy to alleviate pain. They go and buy something to alleviate itching, but that does not kill the problem. That's why I'm insisting on. It's like this. You who are watching us, something is in your compound here in Nairobi, here in the Rejuis. Something is bothering us. Something is making ruffling leaves in Muthaiga. Something is there in probably in Hurlingham. Kumbe is a lion, and you are imagining that it's a cat. Kumbe what we have had cases here in Gong where lions and cheetahs have come into compounds, and the owner thinks it's just another goat, is probably a neighbor's dog. No. Get to know what you are dealing with. You cannot start shooting in the dark, in the leaves in your garden, in the shrubs, without knowing what you are attempting to kill. Is it a lion? Is it a cheetah? Is it a hyena? Where I come from, there are hyenas that come to compounds in the Theka and Ngoliba, those areas. So what are you dealing with? This lady has continuous problems that itching, discharging chafu, and sometimes it is no more chafu. It's not chafu at all. Sometimes it is the discharge, which is a sign of fertility. Even cows get that discharge. And she mixes the two. Why don't we do culture and sensitivity? I'm insisting, Daktari, fanya culture and sensitivity. If somebody has stayed with it for some time, 72 hours, culture and sensitivity. Sometimes you start getting even, culture means like the word agriculture, floriculture. Culture it, that means grow it. Peleka kwa lab, and these people, laboratory people, hawajitetei. Watu wa laboratory, sasa unatumia miaka yako 5 kusoma medical laboratory, a degree in medical laboratory, miaka 4, miaka 5. Alafu, you sit there at the mercy of one doctor. The others don't, they just place tablets. Do culture and sensitivity, high vaginal swab, do urine. Urine will also show. so that you may know, what are you shooting? Are you shooting a lion, or are you shooting a leopard, or are you shooting a hyena? What are you shooting? Probably you are shooting your own goat.
Yeah. Now, you see, the first line of treatment usually is antibiotics, which you've said is so wrong. And we've heard of antibiotics resistance. So how serious is this issue with UTI?
It's very serious. Because during those days, our days, our heydays, it doesn't mean that you called us a boomer. I'm a boomer. During the days when I was a Gen Z, if somebody came with an infection down there, with the pruritus itch and ajikuna, we always insisted on bringing your partner. Come with your partner. Because if we gave tablets or capsules that are not indicated for this particular problem, bacteria are just like other living things. They know. Ata paka na panya. When you come with a cat and they are rats, sooner than later they will know there is a cat here. If you came with a mtego, that one which makes noise when it catches the rat, the rats know. When you try to even use mtego for porcupine, sooner than later the porcupines will know there is a mtego here. Don't pass. Same with the bacteria, they become resistant. Becoming resistant means the bacteria are used. You are using so many trial and error. It is finally very expensive because the disease is increasing, and the bacteria you are testing. During those days when we were not boomers, we were Gen Zs. You could not walk into a chemist shop and say, give me 5 amoxicillins. Chapter 244 of Kenya law says no. Kenya law says don't dispense antibiotics, don't dispense antivirals, don't dispense antifungals if there are other doses. Other doses are worse than overdoses. Afadhali overdose, badala ku other dose. Siku hizi naona atiniuzie ile kakrim, ile kadedi something. What, man? To go and treat what? It's another dose. Sooner than later, we shall try all these antibiotics, we shall try all these antifungals, antivirals, antiprotozoans, and they will not work because they were, kama ile kijana alikuwa anasema ngare, that means there is a leopard, kumbe hakuna, kumbe ni paka anacheza nayo. So the riches, when the leopard finally comes, cannot even get assistance. So that's what I'm saying about disease. Let us do proper diagnosis. Spend time with this patient. Otherwise, you lose. The patient may become infertile. The patient may lose some organs. You hear fallopian tubes are blocked. You hear she has something we call endometritis. The uterus is inflamed and it has adhesions. Aligonjeka, akatumia those tablets, atumia pessaries, haikupona vizuri, ikawa na swellings inside the uterus. This woman will not get a baby in the future because the tubes blocked, endometritis set in, the uterus is spoiled, there are scars. The disease lives, every disease. Kama vile unapata scar on the skin, on the outer skin, we can get scars in there. Inflammatory process always heal with the scars. Sometimes the scars heal fibriotically. That means they are big scars. And that's why we have, finally you tell the girl you must go for something we call hysterosonography, HSG. And it becomes very painful, pumping water there to find out whether the tubes are still active. It would have been avoided if the girl went for a simple high vaginal swab culture and sensitivity, or urinary tract, urine itself. We do a culture and sensitivity. And to answer your question, the man should also be tested or use the results of the lady to treat both. na wanaume wanakataa kukunywa dawa. Nyinyi.
Just hold on there. And we have a question, and she's asking, does it affect only women and men? I know we addressed it when we were starting, and it's not a gender issue. It affects also men. We'll be coming back with this conversation. We're talking about urinary tract infection with Ignatius Kibe, and he's here to answer your questions. So call in. There is a number on your screen. Also on Facebook and YouTube, send in your questions. We'll be sure to read them. And Daktari is here, of course, just for you. Stay with us.
Are you ready to elevate your business game?
As long as you're earning something, there's always that opportunity to save. And you start with where you are.
Kama wewe ni mfanyabiashara, huwezi kaa bure, unajipanga taratibu vile inavyofaa.
Join us each week as we dive into the stories of the world's most driven entrepreneurs.
When you pay attention to detail, you get luxury items.
The Grind, where business meets brilliance. Tune in every Monday at 7:30 p.m. because your business deserves the best.
Hey there, friends. Welcome to Kids on the Block, where fun and imagination come alive. We dive into magical world filled with exciting adventures and awesome friends.
What position were you in?
I was number 2.
What position were you?
Number 1.
He decided to cross the bridge by his house and look for food on the other side.
We're going to do half cup of chocolate chips, and the other one, we're going to do half cup of the blueberries.
So, grab your imagination hats and get ready to explore with us. Join us every Saturday at 9 a.m. for new friends, amazing stories, and tons of laughter.
Join us as we explore the journeys of those who defy the odds and break barriers. We dive deep into the stories of triumph.
Sometimes when parenting a child with a special need or whatever disability, family life becomes a bit complicated and you may end up raising the child on your own.
Here, we inspire.
I have a farm, which one we showcase with
Welcome back. You're watching Morning Cafe. It's Health Thursday, and at this point, we're talking about urinary tract infection with Ignatius Kibe. He's a gynecologist, and he's here to answer all the questions that you have. So I'm reminding you and inviting you to be part of this conversation. Call in, the number is on your screen, and on Facebook and YouTube as well. Drop a comment and any question that you might be having. Now, before we went on that very short break, Daktari, we were talking, somebody had asked if it only affects women and men, but we'd addressed it while we were starting this conversation. But how differently does it present itself in men and women?
Well, let me use a colloquial language. Let me call it the geography. The geography of a lady and the geography of a man are very different. We call it anatomy, the geography of the organ. The man has one longish urethra which brings urine, and it also brings semen during the sexual intercourse. The woman is broader. The organs of a woman are broader. They are bigger. The surface area, if you took the surface area of the reproductive epithelia of men and the epithelia of women, you find the woman is wider. When a woman sits down, if she doesn't sit properly the way you are sitting, sometimes the organ can even touch what she's sitting on. That means the surface area is more exposed in a woman than in a man. But they both get men, when we finished the first session, I said, you people refuse medicine, but you are more, you might even be even more affected and infected than women. It's only that the surface area of a man is smaller as compared to the surface area of the lady. And the lady's urethra, ile ya kuleta mikojo, is very short. Ya mwanaume ni longish. So the man will feel a small itch. May also have a discharge if it is something like gonococci, gonorrhea, or something like chlamydia, or even syphilis. You find the man might feel like when he's urinating, he feels like he wants to twist his organ. He feels a burning sensation. Sometimes even gets discharge at the tip. When a man, many men, you know, they ignore. They even tell their wives, and this is wrong. I'm saying it is wrong. Enda ukatibiwe, mimi sio mgonjwa. They go and get treated, I'm not sick. You are sick. Bacteria are so tiny, viruses are even tinier, but you are sick, bwana. If your wife has an infection, you have the infection also. You imbibed, you got the disease from your wife, or you gave her. In fact, many men are the contributors. I want to put it to you and to the viewers. Something like cervical cancer, or cancer of the cervix. It is men. It is a sexually transmitted disease, and it is men who are the vectors. They carry from Atieno to Wanjiko to Kamene to Inyangala, namna hiyo. So it is the man who actually transmits. It's like malaria against the mosquito. The mosquito is the vector. A man is a vector of very many of what we are talking about. So men are sick. They have the diseases. And it is useless, it is waste of money and time for a doctor to treat one of them. I'm saying to you that during my time, we could not treat one of the two. You must come with your partner. Especially men who are like flies. They, like I said, in the morning, a fly is sitting on a carcass of a dog, is eating a dead dog. Within 2 hours, a man has gone for wrong call, and there is Murphy, and the fly is there again, and the fly moves again from there to your food. Imetoka kwa mbwa ambaye amekufa, imeenda kwa haja kubwa ya mtu, imeenda kwa chakula yako. It is transmitting bacteria from there to this other one. The same with some men. Like I said, started with probably Kadambi, a girl, beautiful girl from Meru or Embu. Then went all the way to Machakos, did the thing again, went to Kakamega and did the thing. He's transmitting disease. He's a sick person. We say multiple sexual partners.
And we have a question for you, Daktari. She's saying, hey TV47, I'm watching from Kajiado. Please ask Daktari, I have around 4 small white rashes on one side inside of my vagina. What could be the problem? Sometimes they are painful, but most of the time they are not. What could be the problem?
It's a mixture. The way she explains is like there is a small organ that women have, which is not visible to their naked eye, called the Bartholin's glands. They are at the bottom, the lower side of the private parts, and they are hidden inside, and they are the ones that lubricate the ladies' organs when they are having intercourse. Once it gets inflamed, it is painful, especially dyspareunia, especially when the man is there. It can present with a small, call them pimples if you want. Pimples, we call them papules or vesicles. So it is inflamed, there is an inflammation. Either that one or that one, plus many women these days get candida. Especially because this new technique, this new behavior of ladies of wiping themselves after going to the toilet, the small call, what do you call it? Kukojoa. When they urinate, they then wipe with a tissue paper. What is tissue paper? It's recycled paper from Dadora dam site. And nobody can disinfect it. And then you have placed it there. And it is highly infectious. Then there is Candida.
Interesting. Just stick to that point. You see, they tell us to, of course, use tissue papers. And maybe it's the
Who tells you? You shouldn't.
So what is the better option?
What was your grandmother using? There were no tissue papers then. And they got 10 children. You people cannot even get 3 because you get infections from these tissue papers. And the hygiene of that area is very important. I'm asking you, your mother, the boomers of ladies, got 9 children, 8 children, your grandmother 12, 11. You people, 1 or 2. Why? Because some of these environmental infections, like Escherichia coli, E. coli, Salmonellas, what I call the TV here, Trichomonas vaginalis, they are in tissue paper, bwana. Candida albicans. There are 7 types of Candida that I personally know, 7. The commonest is Candida albicans. Now, it is all over. It could be even on this seat. It could be when you are sweeping, you pick it up. So, tissue paper is the wrong thing to clean. And you are always told when you clean, or even if it's a baby girl, clean backwards. Now you are cleaning this way. You are bringing Escherichia coli, E. coli from the side of the large col, the big col, what do you call it, feces. And between the backside, let me use the word anus because for lack of a better word,
okay.
Toka hapo kuja mbele, you have E. coli. It's the biggest, in the whole world, E. coli is the biggest cause of infections. And it is normal when it is at the back. When it comes to the front, it causes havoc. So I'm telling girls, please, even if you have to use tissue paper, be very careful, wipe it out, and wash thoroughly with water later on. Or even better, look for soft cotton cloth, wet it up, and wipe with it. But this habit of leaving even tissue paper there the whole day, you are contaminating your IV. It's going to get all types of infections. And I'm telling men who think that if a woman tells them that I'm discharging, I'm having a small discharge, I think it is Candida, then he says, ni ile mambo yako ya kwenda nje. A fight starts. Kumbe, it is tissue paper which brought her the problem. Sometimes it's just dust, the environment. Sometimes it's natural. Something like even cancer-causing viruses, even herpes, tujividoda, ama small woods which come around or during menses or thereafter. Or even normally, unakuta mwanamke ana tujividoda ama skin rash or pimples around the private parts. Be very careful. That could be herpes. And it could also be Verruca vulgaris. It could also be, it is a virus. And these viruses, unaona zile viruses za mdomo hapa, inasemekana ana homa kali. Kumbe they are viruses. And if this virus, HSV1, goes there, is again danger. It can even go to cancer. So ladies, hygiene. And hygiene is not going to be treated with the recycled tissue paper from Dadora dam site or from wherever dam site in your town.
All right, interesting. And you talked about something that women sometimes are more predisposed to or dirt.
Yes.
And right now we have women maybe who are not wearing underwears. Are they at risk? And is that a good thing, not wearing underwears? Or
Commando style.
Commando.
Underwear cannot stop a virus. You don't say because I've underwear, I cannot get a trichomonas vagina. Utapata. Sometimes even this underwear, mahali unaianika after washing it, where you are putting it, the dust is also accumulating there. Matatos are passing by, dust from sweeping. So sometimes the underwear itself is the cause of the infection. So we cannot associate bacteria infection, virus infection, or protozoan infection with, that you prevent it with underwear. No.
Just hold on to that point. We have a call for you, I believe, Daktari.
Anytime.
George Odhiambo, good morning. How are you?
Yes, I'm fine.
Talk to us.
I'm asking the doctor, after having a sex with a lady,
okay,
then a lady wiped me with tissue paper. It can affect me. She can affect me.
Okay.
What is that
All
again?
Yes. He's asking if he's had a sexual intercourse with a lady and then she wipes him with a tissue paper, can it affect him?
You see, we said the tip of a man is very narrow and
long
and longish. For there must be contact. What we call, how much is the contact between the tissue paper, which is on a V, and the tissue paper that has a gonorrhea or a trichomonas or a E. coli, which is trying to meander down in a man. No, I don't think the incidences of men who would get infections by being wiped with the tissue paper is very remote, it's very rare. But mind you, I'm repeating this thing for your clarity, for you to get it across. I'm very happy with Donald Trump. He said there are only two sexes. These days there are two men who hire a room. They are called LGBTQ, something like that. And this man is using the wrong side. That side is used for feces to draw out waste. It's like there is an exhaust pipe to remove the chafu from the engine. Is an exhaust, the backside. Na mtu anaenda huko, anaenda na mwanaume anaenda na mwanaume mwingine. That man is exposing himself to very bad diseases. Atatoka hapo na E. coli, atatoka hapo pengine na viruses. So what, and then he takes a piece of paper, tissue paper like Odhiambo said, and he wipes and he thinks he has cleaned himself. No. Bacteria, viruses, fungi, and protozoans, and I don't know what. Those infective microorganisms, including very, very serious ones like those of syphilis, they cannot be wished away. Don't do these things. Let us also, Museveni here said, if my money is coming because of LGBT, wacha ikae. We watch, we pretend. Men, maintain your hygiene, and don't be a multi-purpose man like a fly. Don't go with 10 of them. No, what for? They are basically not, I'm not talking out of experience, I'm only talking as a doctor.
Yeah.
But if you can maintain an infected wife or girlfriend,
good.
Idole. And occasionally, let the girl also go for tests. Let her go for, like we said, high vaginal swab or urine, or even you as a man, early morning urine. Patiana kwa labu bwana. Iangaliwe kama uko safi. It's very difficult for a man to get an infection from the environment. It's very easy for a woman to get an infection from the environment. And don't fight. Don't fight about these things because, like I said, sometimes you get a woman getting wounds or pimples around there because it is a virus, a normal virus, a paranoid herpes. Sometimes there are other viruses like cytomegalovirus. They are here in the air. When I'm talking to you, probably I'm breathing in a virus. Watoto wadogo, small babies and the children, age of 4 or 5, they always get those very acute inflammations on the lips. It doesn't mean that alifanya sex. No, these are things that are they are here in the air, and it's like somebody cannot tell us where common cold came from. Ama nani amepatia nani common cold. The same.
Yeah.
Sometimes you get a woman getting discharge because her underwear was drying somewhere, na fungi like candida ikaiangukia. And in the same context, ladies, don't dry your clothes, especially underwear, in your bathroom. It's so damp. There is water, there is moisture in the air, and in the bathroom, you get a recycle of candida and those. And the woman keeps on getting itching.
Just hold on to that, Daktari. Regina is calling in from Meru. Regina, how are you? Good morning.
Good morning to you.
Talk to us.
I'm from Meru, Regina. I was to ask a doctor.
Okay.
May I have a problem of a recurring infection?
Okay.
Even if I don't use now public washroom. Because anytime I use a washroom, I have to get an infection. I'm trying to see. I don't know now the problem. Nowadays I don't use even tissue. Which is the best now wipe to use, because I get irritation.
Okay.
Yes.
All right. Thank you so much, Regina. She's saying she has a recurring infections, right? And anytime she uses the washroom, she gets infection. So what is the problem?
I want to correct her one area. People have this idea that it is the washroom in the hotel that has the bacteria. It's the washroom in my neighbor's. It is the toilet in the school that has bacteria. No. We said the biggest cause of infection is E. coli, and it is in everybody's haja kubwa. E. coli. In the feces, in the stool, you have Escherichia coli. We only need a medium of making the Escherichia coli to move from the backside, the feces. So that means if to the front. That means if you go to the haja kubwa, we mwenyewe kwako, and then you do it, the first one, pugu, and it falls onto the water. Already the water is contaminated with the E. coli. Even your own haja kubwa can infect you. It doesn't mean that ati sababu nilienda kwa hoteli ndio nimeipata. No. I would strongly advise her to go for what I called urinary. Let her go and give her urine for culture and sensitivity. Ajue ni kwa nini inarudi. Na pia bwanake pia apimwe. Because sometimes you get it in the house. You get the man has it. She gets treated, but the man does not get treated. So how do you finish it? And if she tells the man, let us go to the lab, the man says, no, I'm not sick. You are sick. I'm telling you, men. I'm repeating it. I'm getting excited. I'm getting anxious that men refuse. They say they are not sick. Yet there is a problem. You are sick, man.
All right, Regina, I hope you've gotten your answer. Let's pick this call from James. James, good morning. James? We lost him. Regina, you're telling men that men should also go for these checkups. They're the problem.
You should go, Bwana. You know, once it starts climbing through the urethra of the man, it goes to a place called the prostate gland and seminovesicles. It builds a home there. And the man finally, when he's my age, they will get the prostatitis. The bacteria start infecting him. And also the urinary bladder. The men's urinary bladder eventually gets, and in fact, in men, there is a high increase of kidney diseases. Some of them are being traced to infections. Sexually transmitted infections that were not properly treated. The bacteria went through the longish urethra of the man and sometimes it went and infected the prostate gland and also infected the urinary bladder and then infected the kidney.
Let's get this call from Nicholas. Nicholas, good morning.
Morning.
Talk to us.
Okay, my question.
Nicholas?
Nicholas? I feel above my, every morning I feel pain around.
We can't hear you clearly, Nicholas. Come again.
Good morning.
Good morning.
Okay, I'm asking a question. Every morning I find.
I'm sorry, we can't get him. We can't. Punguza volume your TV, Nicholas.
Anataka kujisikia na kujiona na kuuliza swali.
Okay, Nicholas, punguza volume. We can't hear you.
The pain along my kidney.
Sorry?
Along the kidney. Along the kidney, I find pain in the morning.
Nicholas? Nicholas, can you hear me? Punguza volume and then start again. Okay. We lost him. But you see, we have a question here again for you, Daktari.
Yes.
She's the lady from Kajiado who was talking about having 4 small white rashes on one side, inside her vagina.
Yes.
And she says the small pimples are on the wall of the vulva. So she feels like you did not answer her properly. She did not get what she wanted.
Now, what she should do is, and I used the language of mixed. Most likely she has mixed infections.
Yeah.
Let her go for a herpes test. Herpes test, I don't know whether I should be addressing her or her doctor or clinical officer or whoever. Involves taking a little blood from her and we do what we call HSV1 and HSV2. That is herpes. Number 2, let us do a culture and sensitivity of urine, and also finally a culture and sensitivity of high vagina swab. Once we do those 3 things, we shall know what is bothering her.
Perfect. I hope she has gotten her answer this time round. And Robert is calling in from Kilifi. Robert, good morning.
Good morning. We are wide.
Talk to us.
Hello?
Hello, we can hear you. Talk to us, Robert.
Mimi niko na shida ya nilipatikana na ugonjwa unaitwa hydrocele. Sasa sijui nataka kuuliza daktari anijibu itakuwa namna gani.
Okay, what is the condition again?
I'm Robert.
Okay, toka karibu na TV. Songa mbali na TV tafadhali. We can't hear you. We can't hear you, Robert. Punguza volume ya TV. Robert? All right. When you call in, kindly reduce the volume on your TV or just be slightly far away from it so that we don't have these issues. But thank you so much for calling. We want to take a very short break at this point. We are talking about urinary tract infection with Ignatius Kibe. Of course, we are so happy to hear from you. So don't hesitate to call in. The number is on your screen. Stay with us.
Streaming all your favorite programs on TV 47 and Radio 47 on the go with our new mobile-friendly website. Experience the future of broadcasting. Visit www.tv47.digital or scan this QR code and stream your way to endless news and entertainment. Welcome to the home of untold stories.
As the patron of the Nyanza Professional Forum, it is with great excitement that I invite you to the Nyanza International Investment Conference taking place from 6 to 8 February 2025 at the prestigious Siala Resort in the environs of Kisumu City. This event will bring together critical stakeholders to explore investment opportunities in key sectors such as infrastructure, the blue economy, renewable energy, tourism, technology, and many more. With a strategic location
Hey
On
there,
the shores of
friends.
Lake Victoria,
Welcome to Kids
and a
on the
commitment to
Block, where
sustainable
fun
growth,
and imagination
Nyanza is
come
poised to
alive.
become a beacon of economic development and innovation.
We
At
dive
this
into
investment
magical
conference,
world
you will
filled
have the
with
opportunity to
exciting
explore
adventures
lucrative
and
investment
awesome
opportunities.
friends.
His
What
Excellency
position are you?
President Dr. William Samoei
What
Ruto
position are you?
has
Number
accepted to grace the event as the
cross
chief
the
guest.
bridge,
By
buy
attending
his
this
house,
conference,
and look for
you
food on the
contribute to
other side.
rewriting
We're going
Nyanza's
to
history.
do
Together,
half cup
we can reverse
of
poverty,
chocolate
create
chips,
jobs, and
and
improve
the other
livelihoods.
one,
I look forward
going
to
to do
welcoming
half
you to
cup
this
of the
historic
blueberries.
event. Thank
So,
you and see
grab
you
your
at the
imagination
conference.
hats and get ready to explore with us. Join us every Saturday
We are the
at 9
home of
a.m.
internationally
for new
recognized
friends,
education.
amazing stories,
We are Malawian
and
students
tons
studying
of
at
laughter.
Mount Kenya University.
We are students from Uganda.
I'm a student
Join
from
us
Angola.
as we
We
explore the
believe
journeys
in
of
making
those who
university
defy the odds
education
and break
affordable
barriers.
and accessible. We
We
will
dive deep
enable
into the
you
stories of
achieve your
triumph.
career goals.
Friends when
Join
you
us
try.
today and let us turn your ambitions into reality. Mount Kenya University, unlocking infinite possibilities.
Here, we inspire,
Msikilizaji, Radio 47 station yenye watangazaji wa haiba kuu, Captain Emmanuel Masumbe, MC Jaffe ama Able nchini Kenya.
Ninaitwa Alex Mwakideu,
Ali Hassan Kauleni, tunavuma
Mkamburi Chigogo,
ni Manucho the Young Roller,
Dr. Funike, the Big Bad Papa Nasti kwa kishindo.
Mama Taifa Eva Mwalili,
Naitwa Baruk Mwalimu.
Bwana mimi naitwa Billy Mio Kipenda, kamanda wa hizi shuli.
Na bado
jina langu ni Fred Arocho,
Lizmit Beatrice Maganga.
Hii imeenda ni ya kutikisa.
Kate Kuno, the Queen of Rumba.
Lucky Heriano,
Edwin Smith,
Collins Lusweti,
Wadi Mwema.
wewe uchunge bwana, kitu nzito itamaliza wewe.
Radio 47 hapa ndipo.
Tazama Mfahamu Kiongozi, ambapo kila kipindi kimejaa maana.
So staying with us, you're watching Morning Cafe and it's Health Thursday. Once again, we're talking about urinary tract infection with Ignatius Kibe, who is here to answer all the questions that you have, and they're coming in. And we do appreciate you for being part of this conversation. I want to remind you to call in. The number is on your screen, but when you do, kindly reduce the volume of your TV. And Daktari has told me to tell you that do not call it just UTI, call it STD or pelvic inflammatory disease, that is PID. All right, I want to go.
Absolutely.
I want to go straight into the questions that are coming in for you.
Anytime.
And this one is saying, mtu akienda na mwanamke alafu anatoa vitu za white, shida ni nini?
Mwanamume ama mwanamke anatoa vitu za white?
Amesema ameenda na mwanamke, so I think it's the lady.
Is the lady who is having
this white discharge?
Usually the white discharge, the commonest problem is candida. And where I went to college, they used to tell us that candida, nearly every woman has candida. Only that it is not proliferate, it's not big, it's not a big issue. But it is made worse by antibiotics, it's made worse by pregnancy, it's made worse by hygiene.
Just hold on to that. We're coming back to that particular question. But Olo is calling in. Good morning, Olo. How are you?
I'm good.
Talk to us.
I just wanted to ask a doctor a question because I cannot control urine.
Okay.
Ikikuja, if I don't go to the toilet within 2 minutes, itatoka tu peke yake. What might be the problem?
Okay. Thank you so much for that question. Daktari, hiyo umepata vizuri sana. I can see.
Umeipata. Now, although I would have wanted to know how old you are, because that's what we call urgency of menstruation, urgency of urinating. And
I'm 54 years.
You are 40 years.
54.
54
years. If I was to, I would check 3 things in you. Number one, I would check an infection by doing a culture and sensitivity of your urine for culture and sensitivity. Number two, I would want to know whether you have any daliri ama any possibility of a pre-diabetes or diabetes. Number 3, I would check the prostate gland for prostatitis or what we call BPH, benign prostatic hyperplasia. So there are three reasons. Number 1, get checked for diabetes. Number 2, get checked for prostate.
Yes.
And number 4, culture and sensitivity of your urine. And we shall get the problem. By the way, at 54 years, the 3 things that I have mentioned are very, very common in the men. Anywhere in the world, you are not alone.
All right. Olo, asante sana. I hope Daktari has answered your question.
But I went somewhere. Aliniambia, huyu doctor aliniambia nikienda choo, nisike tu, kabla kujua nisike penis, kujua ishitoke.
Hapana.
And then I release.
Hapana. Utaharibu. Ushike penis, ili mikojo isitoke, sasa utakuwa na infection. Hapana, shika. Enda upimwe tujue ugonjwa ni gani. Enda upimwe. Tupime nini? Culture sensitivity ya mikojo.
Yes.
Hasa mikojo ya asubuhi kwa wanaume, mikojo ya asubuhi kutoka ukiamka tu namna hiyo unachukua hiyo mikojo, ukisikizana na laboratory watapima culture and sensitivity ya mikojo.
Yes.
Number 2 tumesema uangaliwe pre-diabetes or diabetes. Number 3 tumesema uangaliwe prostate gland and prostatitis.
Okay.
Tafadhali.
Okay. All right. Thank you so much, Olo. We appreciate you for calling us. And there was this question that we were addressing, and he was asking mtu akienda na mwanamke anaona some white discharge, and you addressed it. You said it could be candida. And we have another question, of course. Daktari, we noticed that my wife has a discharge that has lasted for 8 months without ending, even after medication. And when we have sexual intercourse, it makes me also get some rashes that goes away after staying for a week without sexual intercourse.
Most likely, again, candida. And I'm telling doctors, I'm telling clients, I'm telling our viewers that this candida is very common. It's all over, and it should not be a source of fight in the house, because, like I mentioned, nearly every woman has an element of candida. I'm also saying that it is possible to do culture and sensitivity. It's also possible to do what we call KOH, potassium hydroxide, and many doctors don't do that thing. KOH, potassium hydroxide stain, and you'll see whether you have hyphae or you have cysts of candida. So get checked for candida, and get checked for the other bacteria cohabiting. And get...
Just hold on to that. I'll remind you of that. Get checked for candida. But Dorcas is calling in from Kisumu. Dorcas, good morning. Nakuru, how are you, Dorcas?
I'm fine, thank you.
Talk to us.
Niko na swali nilikuwa nauliza.
Okay.
Nimekosa period kwa mwaka mmoja.
In there?
Nimekosa period kwa mwaka mmoja.
Okay.
Na nilikuwa nimeenda hospitali. Nikafanyiwa FSH. Na prolactin, wakasema ziko sawa, na nikapewa dawa nikunywe na bado period haijakuja. I'm 34 years. Sasa nilikuwa nauliza shida inaweza kuwa wapi? Niko na watoto wawili.
Okay.
Nilikuwa natafuta watatu.
We call it amenorrhea. She's Dorcas.
Dorcas, daktari
it is called amenorrhea. And they should not do only 2. They should do a minimum of 6. FSH. They should also do the prolactin that they did. They should also do what we call the LH. And they should also do progesterone. And finally, a very important one, a group of hormones called estrogens. unless you do all the 4 or 5 of these hormones together, we cannot know. By doing only one, FSH is follicle stimulating hormone, you cannot know where the problem is. And that is a very big problem with us, doctors, and with clients, our patients. They are all having those menstrual problems and the language of hormonal imbalance. What is hormonal imbalance? Until you learn and you study which hormone. If you have punctures of your car every now and then, you must know which wheel, which side of the car gets the puncture more often than the other. So that probably is the rim, probably it is a problem with the tire of that side. You cannot do one and determine the reason, like they did only prolactin. Prolactin is when a woman has very high, we call it prolactinemia, very high prolactin, sababu alikuwa ananyonyesha. Na ukifinya matiti, inatoa maziwa ama maji. That is prolactin.
Yeah.
The way she explains, the amenorrhea is kukosa periods. What are the hormones? Which are the hormones that bring about what are the hormones that bring about menses or menstrual flow? You must measure all of them. Sio moja ama mbili. And then the best time to kupima ni late proliferative phase. Yani siku ya 13, 14 hapo. 12, 13, 14. The other problem is these family planning things that you ladies are using, like e-pills, they all cause this hormonal imbalance. So before you condemn one hormone, check all of them. Check all of them. Don't check only one. And then the other thing is your general body health and your diet and lifestyle.
Yeah. All right. And you know, Daktari, we are almost done with this conversation, but I want to...
hatujaenda mpaka...
I want to join this question, and these are the questions that are coming in for you.
Yes.
What happens to untreated UTI in the final, if it's not treated on time? And Babu Statesman is also asking from Isiolo that what are some of the medications for urinary diseases? And this one is also asking, hello, he should also tell us the solutions, like let him recommend remedies of every sign.
It is not very good to do treatment on TV. It's unethical, it is illegal. We cannot mention diseases and the cure and disease and the cure. No, first, let us personalize every problem. We cannot say this antibiotic is better than the other because it may work on you and it doesn't work on the other. The other one is to know that the minute you notice a problem in your genital urinary, know that it can escalate, it can become worse. Know that finally it can bring you subfertility, unaweza kupoteza hizo, spoil the genital urinary tract, get scars, it can cause miscarriages. These problems can cause a baby who is being born. For example, herpes. When you are getting a baby, when you are pregnant and you have this disease, the baby can come out with herpes, sometimes gonorrhea. As the baby comes down, the baby can carry the gonorrhea into the eyes. Unaona mtoto amezaliwa, a very good young baby, and the eyes have discharge, yellowish, creamish discharge. So it is possible if somebody has herpes, for example, or acute gonorrhea, and these days we have another gonorrhea which is very bad because it is highly resistant to antibiotics. If a baby gets those, the baby will be born blind. The baby can get herpes of the eyes or herpes of the rest of the body. So there are very many you should be treated. You get treated, the proper treatment. Don't treat yourself by asking for a few capsules. Ati nipe amoxicillin 5 hapo, nipe doxycycline 3, nipe Septrin 5. Apana. Na nyinyi pharmacist, you must adhere to chapter 244, 245 of Pharmacy and Poisons Acts in Kenya and internationally. And you must know that you are making, by selling these antibiotics, antivirals, antifungals in small doses, you are creating a lot of resistance. There is a big problem. And then there are another class of people that I want to warn, medical reps. They decorate their products so much that, and they sometimes even bribe somebody. These days, they bring us diaries, they bring us calendars, sometimes they call us for dinners so that we may prescribe their product. And sometimes it's not the only, and is not the best. So why don't we follow? My key word is culture and sensitivity testing, which takes on average 24 to 72 hours, culture and sensitivity, so that we may know the animal we are dealing with. Don't just give at nisafishe. No. Doctor, don't get lured into kusafisha mtu ama kumpea tu dawa ya kujikuna. Get to know what is the animal in your compound. Get to know what is the best drug which will hit it so hard that it will not wake up. Because the whole world is crying, especially about patients from Africa. Because they are saying that we are either treating without proper diagnosis, and we are not using labs, and we are not using diagnostic equipment. Please use these things. It is scientific. Don't even, it's just like in a shamba. Don't go using at the Roundup. No, get to know what is the best. And when you deal with an animal or a plant that you want to exterminate, gonga haraka na honga sana.
All right. Asante sana. That is Ignatius Kibe, a gynecologist. We've talked much about urinary tract infection, and he has said that don't just call it UTI, call it an STD or a pelvic inflammatory disease, that is PID. And just to remind you, it does not affect only women but men as well. And culture and sensitivity testing has been stressed by, of course, Daktari here. And of course, right about now, that brings us to the end of this conversation. Thank you so much for watching and for being part of this conversation. My name is Anne Odida, and Fred and I will see you bright and early tomorrow. But right about now, here's Fitness Thursday. Hello and welcome to Fitness Thursday. You're watching